Hello, everyone. Welcome to the Community Rec Magazine Virtual Roundtable, Navigating the Pandemic, sponsored by Weld Health. Today, we'll be discussing the COVID-19 crisis, and hopefully we'll be able to shed some light on how to navigate through this crisis successfully. I'm Bobby Dyer, the editor of Community Rec Magazine, and I'll be today's moderator. On our panel today, we have Chris Tointon, the president and CEO of the YMCA of Greater Omaha, Art Krueger, the director of the Wave Aquatic and Fitness Center in Whitefish, Montana. We have Carrie Ohorodnyk, the executive director of the Rose E. Schneider Family YMCA, and Todd Rockoff, the president and CEO of the Tucson JCC. So here's how this is going to work. We'll take about 30 minutes for a moderated Q&A with our panelists, and then we'll open up the floor to questions from the audience. This is for our listeners. Please submit your questions as they arise on the GoToWebinar control panel, and we'll take time to answer as many as we can in the last 30 minutes. Now, we probably won't be able to get to everyone's questions, but I'll do my best to get to as many as possible. So let's dive in. Chris, I'm going to start with you. Let's talk about how you've been impacted from a community rec center operations perspective. Can you share your thoughts and experiences from the pandemic? And then we'll go down the line from there.
Yeah, I'd be happy to. It's been definitely been a challenging ordeal for us. We had to really quickly close. We have 10 facilities. We had to close all 10 of those facilities. We're fortunate enough to have child care centers located on 3 hospital campuses, so we were able to really pivot and allow for child care to happen for essential personnel. So we've been happy to been able to do that, but immediately had to furlough about 1,000 part-time staff. And then over time, as things got more spread out, we've had to furlough some additional full-time staff just to make sure that we make ends meet and we have a good financial standing for when this comes back. Most of our members have decided to stick with us and have held their membership and not canceled it. We're thankful for that, because that's really saved us from having to do even more deeper cuts than we'd really like to do right now. So just like everybody else, closing facilities, having to put staff back home and not having them work, and really rework how we work. We're all working from home. The folks that are still working that aren't in childcare, we're working from home offices and trying to make do with what we have.
All right. Art, what's been your experience with the Wave?
You know, it's very similar to Chris in terms of having to shut down immediately. We did a voluntary shutdown March 17th, and we were able to keep employees working for the next 2 weeks on various deep cleaning projects, things like that, but eventually had to furlough all of our staff. And we've kept a few on through, in particular our marketing and office manager, things like that. But we're looking forward to opening for sure, and planning on bringing folks back. But at this point, we've had to close down operations nearly 100%. And like Chris, we've had a lot of our members stay with us. We've had a very small percentage of cancellations. We automatically froze all of our members. We're not charging any dues, anything like that at this point. So it's been fairly positive on that end, and we're looking forward to getting back. That's for sure.
Oh, I'm sure, definitely. Carrie, can you share your experience?
Sure, absolutely. So we have 2 branches and a park. So right now, you know, it's coming up to park season, so we have to make decisions based on if we're going to be able to open. You know, so we're just waiting for the governor's orders on that. We took our shutdown when we were mandated by the governor to do so. We held off as long as we could as a facility standpoint, and then as well as for our child care facility, we ended up keeping that open about an additional week or so after the facilities themselves have closed. And that was right around that March 16th timeframe too. Same with Art. What's a little bit different from us is we continue to pay all staff, part-time, full-time, and exempt staff through this entire process. So that's certainly been difficult decisions, you know, moving forward, but certainly one that we value very much and hope to continue to do as we move through the process.
Perfect. And Todd, what's been going on from Tucson?
So very similarly, we closed down on March the 16th, and made the decision that till the end of March, we would continue to pay all of our staff. We had this hope, I guess, that we would be able to reopen in April. And when that became evident that we wouldn't, we made a couple of very, very difficult decisions. We did not charge people their membership dues or their tuition for our child care or other programs, which effectively was a loss of about $800,000 in income for the month. And in doing so, we ended up having to lay off about 95% of our staff. During that 2-week period and beyond, we've moved to a completely virtual environment. We're offering virtual fitness classes, we're offering educational classes and discussion groups and so on. And we offered members in April the opportunity to either continue to pay membership if they chose, freeze their membership, or consider making a donation. Majority of people chose to freeze their membership, which actually we were grateful for because it's far better than cancellation. And we were fortunate that a number of people were generous and either gave us their dues or made a nominal donation to help keep us at least functioning as much as we can as we work our way through it. And the big decision point now is summer camp. With schools virtually ending mid-May, will we be able to get camp up and running by the beginning of June?
Yeah, definitely. And actually, Todd, how have you been able to communicate and kind of stay in touch with some of those staff members you've had to lay off? I mean, I'm assuming you would want to bring back as many of them as you possibly can after all this is through.
So we have remained in touch through email. We've tried to support them through the process of applying for unemployment. We were grateful that by paying them for the last 2 weeks of March, they actually got a full paycheck on April 3rd. So hopefully at that point, between unemployment and the stimulus check, it gets them reasonably through the month of April. And now we're really looking at May, and we're pretty close to making the decision that we're going to announce that we're not opening May 1st and going to set a new goalpost at the beginning of June and hope to exceed that.
Right. Carrie, can you jump in on this topic too, regarding communication with staff members?
Yeah, sure. So since we're a little bit different than that, we were continuing to pay staff and so on and so forth, and we're kind of just putting out communication enough that we know decisions about. We don't want to get too far ahead of the game in case if we do put ourselves in a position where we're not able to continue to pay staff. So we're being very cautious on doing that, but really communicating very regularly with them almost every other week. Our CEO is putting out a video message to really put that personal touch to the communication, and it includes something inspirational. Plus, it also includes any updates on information that we have. For instance, one went out today with an inspirational message from him, as well as that we would continue to pay staff through May 8th because our governor has extended the stay-at-home policy until May 8th here in Pennsylvania. So we've extended at least till then so that staff are like, okay, what happens after this date? And so we're trying to keep them up to date on what's going on with that. And he's trying to keep it very light. He's a huge Kenny Chesney fan. Today there was a song by Kenny Chesney to go along with it. So he's done, and what I like about the communications that he's provided is that they're real and they're genuine. They're not staged all real nice. He literally one time was walking into the Y carrying his phone like this from his car and just said, hey, this is the moment I thought about all you guys. Here's why I thought about you, and kind of rolled with it from there. And that if he doesn't send one out, I send one out to the team too. And then not to mention all the directors that are reaching out to their teams personally as well. They're holding Zoom calls, Zoom social times, because it's not just about us communicating with them, it's about them communicating with each other. And you get them, it's almost like my daughter's in 2nd grade, so they do Zoom classes and they're all talking all over each other. And it's literally, I was just on a membership staff call yesterday, I think it was, and I got on and it's like, what are you doing? What's going on? you know, so they need that too. Let's face it, we work for community organizations. We thrive off of people and each other. So anytime we can get them to connect is key. So
Yeah.
Yeah.
It'd be fun if this call was a lot like that, wouldn't it? Well, yeah, Chris, can you talk a little bit about your staff situation? You mentioned having to put a lot of the part-time staff on furlough, I believe.
Yeah, so we've kind of had to, the first 2 weeks were chaotic, and then all of a sudden we looked up and said, are we communicating enough? Are we even communicating? Who are we missing out on? And so we put a real structured process together for communication so that we don't miss anybody. We have Tuesdays with the execs and Wednesdays with the rest of the staff, and part-timers get a video call every Friday. So we've had to get really disciplined so that we don't miss out. There's so many different groups when you have an organization that's spread out like we are in 2 different states and all over the region. Then in addition, we're doing something fun. I think Carrie mentioned that to do kind of a more social call. We have Zoom happy hour this afternoon for all of our full-time and key leaders. And every week we're going to do this, and each week kind of has a theme. So this week is Bring Your Pet Week. And so we're going to try to break down some of the barriers and make sure that we have a social connection with our team, have some cats and dogs. And I think Carol Baskin might show up with a little critter. So we'll try to have some fun, but ultimately it's just making sure that we have that connection. It doesn't have to always be work. We're a family. You know, we practically live with each other here with as much time as we all put in. So finding ways to have that human connection, really critical. So yeah, those are the 2 things besides what Todd and Carrie already talked about, that it's just really important to keep on that.
Yeah, definitely. And Art, how are you keeping your staff engaged during this time? Have you had to lay anyone off? Like, what's your situation?
Yes, we've had to furlough everybody. I do have some of my managers back working now. You know, Chris, you got to be careful those happy hours. They start to mount up. I got like 3 happy hours every week, so I got to be careful. You know, it is. You have to be creative. We have a smaller staff here than some of these other operators, but certainly texting, making it personal, I think is huge, because you want to keep that social connection, just like Carrie said. I think, you know, we want to be around each other. We want to feel that. And after now, you know, 6-7 weeks, it gets really difficult. And we want to make sure our employees aren't falling into any type of depression or anything like that, because they're so isolated. So yeah, we've made real efforts. One of the things that several of our managers are doing is getting people out of doors. You know, I have the luxury of being in northern Montana, and, you know, I've got the great outdoors right here. So we're hiking and biking and, you know, keeping distance, but being in, you know, some small groups. So that's been effective for us.
Perfect. Well, let's pivot a little bit to communicating with members. Todd and Art, you both mentioned freezing memberships versus having them cancel their memberships and kind of giving them that option. Carrie and Chris, I wanted to get your perspective on this, on what you did with memberships, you know, whether you allowed members to cancel them, freeze them, and then whatever the decisions were, how you communicated that to members. Let's go with Chris first.
Yeah, that was probably one of the toughest decisions you had to make, because you had to do it with virtually no information about how long this was going to last. We made the ultimate decision that we would continue to draft our draft memberships, but we would give every member an opportunity to kind of opt out. So we sent a few communication. I think there was 3 in total before we did our first draft, to say you have the same, I think Todd mentioned the ability to donate to keep your membership and stay active, or put it on hold. And we were very fortunate. We had, in the first month, we had 25% of the memberships go on hold. So 75% were still with us. And so far in April, we have 70% that are still with us and paying their monthly membership, because they know how valuable the Y is and how important it's going to be to kind of come through. Across the Y system, we've heard numbers relatively about 15% of Ys stopped drafting altogether. Most Ys continue to draft and then provided an opt-out. we take the risk of not making them happy down the road, but we're trying to do our best to make sure that before every draft, they're getting a plenty of communication and plenty of opportunity, an easy opportunity to get their membership on hold if that's what they need.
Absolutely. Carrie?
Yeah, I'm with Chris. We continue to draft members with ample time for communication and made it very easy for them to put it on hold or to terminate. And then those who wanted refunds or prorates in membership. So, okay, they never got that communication, right? You look at the open rate on those e-blasts and you're like, that not everybody's seeing that. So we're obviously getting people calling saying, hey, I didn't realize you were going to continue to draft me. So we make it we're not argumentative or anything. Hey, yep, here these communications did go out. I'm sorry you didn't get it. Would you consider continuing and sticking with the why and drafting your account to help pay for operating costs, blah, 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 blah. And then if not, we do recommend that credit before we try to do a refund so that we can credit future membership dues. And those refunds, that's where we're really going to kind of have to make some tough decisions as to once we know what the total financial impact will be in our association, then we'll have to figure out how we'll waive those refunds back to people. And at this point in time, we're being very vague, like, hey, we're closed. When we reopen, we'll kind of do them in the process that they came in. But yeah, it's that fine line of what you can or can't do at this point to remain financially sustainable during this time. So now we're finally adding in that donation piece. We didn't know how that would work with our current membership software, and we got all the answers on that. So we should be able to put that in place too, to give that option as far as donations go. Because now we're at the point where in March, when we did close, we thought we could make up programs because we thought we'd be opening in April, right? I think everybody on this call probably anticipated opening sometime in April, if not like the beginning of May, where we would have ample time to make it up and maybe cancel one session of programs or whatever. So we're now at the point we're not gonna be able to make those up. So now we're gonna have to touch program service fees. How do we waive that in? How do we refund that? How do we apply that to a donation and so on?
Yeah, actually, can we talk a little bit about the challenges of having to reschedule programs and services and have to restructure those schedules now that everything has just kind of been blown up? What's that gonna look like from a scheduling and logistic perspective once we're on the other side of this? And can I get Todd? Let's get your perspective.
I think it's both an incredible challenge logistically to figure out the other side, but I think in some ways we've also been given a gift of learning how to create these virtual activities that becomes another tool in our toolbox. So we're actually evaluating which of those virtual activities might have some longer legs to them, and we'll continue them as we reopen. I think the guidelines that we're getting around physical distancing, even in the space of reopening, is going to make things like group exercise classes, where very comfortably we had 20 or 25 people in a particular class. We're now evaluating, are we going to offer 2 sections of that class to accommodate 20 people? And maybe there's some other classes that in the past had 6 or 7 people that might have to go by the wayside to make room for a second section. I want to say the advantage of being closed is we do have a little bit of runway to be thoughtful. And as we're thinking about camp today, I know the American Camping Association and the CDC are coming out with guidelines by the 1st, but they're talking about camp with groups of 10 or less. They're talking about no field trips and all of those things. So what does the experience look like? What are the logistics of drop off and pickup? What are the logistics of taking people's temperature? Because I think there's a moment in time the day after where the logistics are going to be different than what they're going to be 6 months from now. And what are the assumptions about whether we open or not? We're really wrestling with how many people are going to be comfortable coming back day 1 through 10. And even people who have registered for programs that are starting in the summertime. And as much as I think there are parents say out loud that they want them to come to camp. They can't wait till kids can be back out of the house. I think when push comes to shove, there may be some apprehension about walking back. So we're going to have to communicate really effectively what the new protocols and policies are as it relates to health and safety. And people are going to need to see it and feel it as they come in.
Absolutely.
Yeah, I'll add to, I mean, I think Todd's right on. I'll add the challenge of it's really not just our facilities. You know, most of our community rec family, they utilize parks, schools, community centers all over the area, and not having control of that, and the schools basically not being in session, they have the ability to kind of wait until August or whenever school's supposed to go back to make decisions. But it challenges us as a community to figure out what's the best way to spread people out and utilize the community assets that are out there. I think that's going to pose one of the biggest challenges for all of my peers, is to say, you know, how are you working with schools and the resources that you normally work with right now to make those decisions for summer programming or even fall programming?
Yeah, definitely. Art, I'm curious to get your perspective about, you know, the impact of all this on programs and services, because being in Whitefish, Montana, outdoor programming is such a big component, I'm sure, of what your community enjoys. How do you think this is going to impact, you know, the logistics of your rec center?
Well, you know, I would concur, first of all, with a lot of what Todd and Chris just said. I think our entire environment's going to change from this point forward, and how we utilize our resources. Speaking of, you know, our community resources, outdoor, et cetera, right now, our guidelines are set to mid-June before we can really resume activities outside. So, you know, that is well into the summer break, and that's time lost. But I think that there is big advantage virtually to be able to put programming out that families can follow. They can use the out of doors, these public places that might be out there for exercise routine activities that you can do as a family. So really, that's where we're going to be trying to focus our efforts, at least initially, to still serve the community in that way. We can be a guidance, a resource, if you will, for those activities, and that's how we're going to try to accept that challenge. Moving forward from there, I agree. When you start looking at any restrictions from group sizes and things like that, you got to start from the basics. You have to look at it, even as a nonprofit, you got to look at it from the business standpoint. So how are we going to put enough personnel out there and resources to maintain safety standards and things like that? So those are all the things that we're excited about, because I think there's going to be a better service, a better quality of product that we put out there. But at the same time, we're going to be challenged.
Well, for sure. Carrie, did you have anything to add about the, you know, logistical challenges of programs and services after all this?
I think it'll just be really, I mean, the director team here is already working on how to restructure our cycle scheduling as we move forward. But really, like everybody else, camp is the most detrimental decision at this point as far as programming goes. So yeah, we're waiting to hear more on that.
Yeah.
Well, camp's so important right now because, I mean, the kids have been out of school for 2 months right now. They're already losing they're getting behind, especially those kids that are in more vulnerable states in their community. And then if we lose months in summer camp time, it's going to be awful hard for those kids to catch back up, not just summer learning loss, but having those 5-6 months worth of learning loss. I think we're really trying to step up and figure out how we can program, if we have to, from educational standpoint, to the more vulnerable community, because the rest of the community is going to have parents that are going to do physical activities with them. They're going to do schoolwork. They're going to do reading. We need to access those kids who don't have those home resources.
Yeah, and I would add to what Chris is saying there. I think, you know, particularly in our area here, we have a lot of bodies of water. As soon as the weather starts to allow, we got kids going out in masses, and you got water safety issues all over the place. So, you know, part of what I'm challenging some of our folks with is how do we get that education out there for swim safety, some of the basic, you know, life-saving techniques that are out there. Encourage parents to look at flotation devices that are proper for kids, whatever it might be. But there's certainly, I think, an increased risk because they're not in our pools right now learning how to swim properly or take care of themselves. So
And we have some fun videos if anybody wants to check them out of swim safety. We're series 4 now, lesson 4 at metroymca.org. A couple of staff got together and did some fun safety videos because we're missing out on those kids. Spring's really critical to us. We go to a school system that has 40,000 kids, and we teach every second grader swim safety, and we didn't have that opportunity this year. So we're trying to do whatever we can to get them still that activity, all the stuff that's really important of when to go in the water, if somebody's stuck, not jumping in and going after them if you don't know how to swim, but using the tools that you have at your hand. So those are things that we're having to do and be creative about.
That's great.
Yeah, I'll just add on to that I was speaking with our Association Aquatics and Training Director this morning, and she advised that the Red Cross is doing, everybody, it's amazing how this forces everybody to move along very quickly in how we do things, but they're laying out provisional classes where a lot of the lifeguard certification courses can be done virtually. And then once you are able to be inside, indoors, you can finish them then. Or if you're able to get them a CPR dummy, if they came and picked them up and you organize something that way and cleaning of them and everything, they could take it home and the instructor could watch them on a Zoom call or a call just like this to be able to see if they're doing the skill correctly. So they are making changes as well to help that side of things. Because when we do open, a lot of us have outdoor facilities and different things, and lifeguards is going to be the biggest thing. So we'd all be hiring a lot right now, for that type of thing. So trying to get folks on board with that.
Yeah, absolutely. I mean, I'm sure the youth demographic of the community rec centers is being impacted, just as hard as a lot of other areas, because they are so used to being in those sort of like developmental environments, either at school or in after school programs. Have any of you found any good ways to keep those kids engaged in any way, especially like maybe virtual after school programs, or just any ways you can get kids engaged while they're at home all the time?
Just with our, go ahead.
Carrie.
Just with the virtual classes group exercise classes that we're doing for adults, we are offering kids gym classes, as well as other resources that we put online to put out there from preschool age up, of different activities for them to do as well. So I just really encourage them to work out with their parents, and do the full family deal. I know that I just recently got an email from our Healthily Living director that she got feedback from a member that said, hey, our whole family was able to do this together, which, when does that ever happen other than when you're to stay at home, right? So.
True. Yeah, Chris, did you have something to add?
Yeah, I was going to add that one thing we learned over the last 6 weeks is that the teen group, that age category, needs more attention in smaller groups. So our team leaders have been trying to get them in small groups just like this, where we have 6 or 8 people. So it's not chaotic, in that each youth can find their voice. Normally those kids are planning teen nights and activities for their peers. Now they're thinking about, well, what are they going to do this summer, and how are they going to keep their peers focused and do things. So we're counting on those kids to give us those ideas and thoughts, rather than for us to try to figure that out. I have 2 teenagers, but I still couldn't figure out, because both of them are opposite ends of the spectrum when it comes to physical activity or mental activity. So it's really nice to be able to involve them in it and ask for their ideas. I think everybody, when you're not in a social environment, wants to be heard something. So that's one way that we're trying to do that.
Okay. Todd, do you have any ways that the Tucson J keeping youth engaged?
We're really working to, our teenage groups are still meeting every week. They're doing it by Zoom. They've planned a couple of nice programs. I think they've been really creative in that way. The group younger than that, we are offering some classes, and I think, like Carrie said, it's nice that some of the parents are participating with their kids. I think what's missing, and going to be missing even into the summer if we remain closed, is the length of time that they're not being social together face to face, and some of the picking back up some of those social skills that you get all year in school and that you continue in your after school programming and in your summertime. You're not having that interaction, and reintroducing kids into that in a way that's physically distanced, which will feel very strange as they get back together, is going to be, I think, a real challenge for all of us in the recreation industry to reteach how to interact socially when the toys or the equipment or the game is really being shared by all, and it's not, I have my screen and my keyboard and my control. So I think we're going to really have to be very thoughtful about the way in which we begin to do those face-to-face activities again.
I would concur, and I think it's going to be a lot with the adults too, Todd.
I was just going to say that. I actually was on another webinar where this week where there was a lot of discussion on how we should be spending time training staff on how to deal with the conflict among members when so-and-so's not wiping off their machine and they're not following this protocol. And yeah, because it's gonna, I mean, we know that people don't follow policies all the time now anyway, and it's just gonna be at a heightened level at this point. So gotta be prepared for that.
I agree. You can't have members policing members.
Absolutely. All right. Well, we'll shift gears a little bit to taking some questions from the audience. But fortunately, this question that we have first is pretty much right in line with what we've been talking about. The question is, do you have any thoughts on engaging in esports for kids? And Chris, I'll actually let you field this question first, since you asked me about it before we started the broadcast.
Yeah, it's really great timing. I was on a call this morning with an national esports provider, somebody that takes care of colleges and junior colleges across the country. I'm on the board of the YMCA of the USA, and I'm on a task force that's looking for innovation. And so as part of that innovation process, the USA is looking at opportunities to engage in esports in a much broader audience to get Ys across the country engaged. And so we're looking at that. We had a couple other people sit on that call with me, and we've identified some folks who are really interested in that. So people can reach out to me if they're interested, and I can get them on the list of, so as we develop those conversations, we can get further and further. But I do see esports as something that can really bridge what happened over these last 6 weeks, is to say, you know, the esports can be something where you engage in person and at your Y or your J or your rec center, but they can also then break out and go into different directions. And you know, esports teaches you a lot about teamwork and competition when you're not, you know, physically counting on your partner or your teammate, but you're mentally counting on them. So there's some really good strategies with this. I have a 15-year-old son who's on the esports team at high school. And so it's really interesting for me to learn about this, because when he talks about it, I don't understand a thing. So I need somebody to translate it for my value. But I think that, you know, esports is going to be something that YMCAs across the country are going to look at as an opportunity to engage that middle age group that we all kind of lose anyways. The 13 to 18-year-olds become harder and harder to serve. So this is a way I think we can all do that. If anybody out there is listening that has that already, we'd love to hear from you, because I think it's really important that we all share and figure out a way to do this together.
Art, do you have anything to add about esports? I know at the Wave you'd mentioned just some new technological developments when we talked a while back. Is esports a part of that picture for you guys?
It hasn't been. We have spoken about it. We're not quite clear on how to bring in the health and wellness piece to that. Certainly it's of interest, particularly if the kids can be active in some way. And I'd be interested. I'm going to contact Chris about this.
Yeah, definitely. Carrie or Todd, any thoughts on esports?
I'll be contacting Chris.
One of the things we've learned about this esports thing is most people my age, I won't bring you guys into my age category, but most people my age, they're envisioning a kid sitting on a couch in a basement, dark room, playing video games for hours. The new piece of esports is much more engaging and much more understanding and team building. It's not you just playing against random people around the country. it really is engaging people mentally and socially. The physical component, we found a lot of colleges getting involved in treating it like the rest of their athletes and holding them accountable to physical exercise, working on therapy. There are things about your arms and your hands and how you sit and how you your back is taken care of. So there's some level of expectation that there's some physical support there, not nearly as much as you would see in a basketball or wrestling or volleyball, but there is that piece. And more importantly, there's a piece of how do I work with my peers in a new environment? So how do I work with them both in the same room, and how do I work with them on this kind of platform? So I'm looking forward to seeing what that can do for all of us in this game.
Yeah, definitely. I'm going to set up all three of the other guys. I'm going to set you all up Call of Duty accounts, and you guys can get started with esports. So our next question, this is also sort of related to youth engagement, but it has more to do with community partnerships. The question is, how are you working with other community groups like children's museums, libraries, and municipalities to coordinate support, programming, and share resources? I'll let anybody tackle this one, whoever can get their answer ready first.
I think, partnership is going to be key coming out of this. We're all, I think, in some way or another going to contract a little bit when the financial reality hits. And I think the ability to work together, I know we're having lots of conversation right now with the local Y, with the Girl Scouts and the Boys and Girls Club about summer camp and what that might look like, sharing some space. While we're closed, and we are completely closed, we've made an arrangement with a local school food provider that they're bringing a truck to our parking lot every day, and they're serving effectively school lunches. So there are a lot of people that are coming up, probably have a couple hundred people a day that are coming to get school lunches so it's using our facility as a community resource. And I think that there is more opportunity when everyone opens back up to say, what is it that we could do to serve the community together in a more effective, less duplicative way?
Carrie, do you have anything to add?
Yeah, so we're currently looking at just ways that we can serve the community in general. So, partner with Red Cross, we're going to do a blood drive. Even though our facility is closed, we're going to open it. Just the way our building is set up, our community room is accessible through a different entrance, so it makes it easy to do that. So we'll be doing that. We have partnerships with some youth homes in the area. So our Healthy Living Director, beginning next Monday, will be providing Zoom classes for the kids that live at a residential facility there. And then our Youth and Family Director has reached out to another family home that she works with regularly to see how we might be able to support them, as well as our location is still a great location for drop off for a food drive. So we're trying to work with some partners on getting that done. Because our facility also, much like some of the other Ys and community centers, we have medical facilities that we lease out, space that we lease out. So those docs are still seeing patients. So although our facility is closed, that side of the building still remains open. So people can come and go still within that side of the building. So we can run that type of stuff. So just trying to see where we can fit in.
Yeah, definitely. Art, what kind of partnerships does the Wave have at the moment, and how are those being used?
Like Carrie, we've partnered with the Red Cross for years in terms of blood drives, and we've continued to support that through this. We've had one blood drive, actually probably our most successful, because people are really paying attention right now to the needs of the community. And we have an exterior exit to our gymnasium, so it was pretty easy for us to do. They have strict protocols in place for that, so we felt comfortable. We actually ran it by our medical director to make sure, and that was very successful. One of the key things that I might suggest that I found here locally is we have a large reach through our social media, newsletters, etc. So we've tried to get word out about, say, our music schools in the community and what they're trying to do, so we can draw attention to that. So we found that that's been valuable to some of our smaller nonprofits in the community.
Absolutely. And Chris, do you have anything to add?
I think one other thing that we're doing is just because we have those healthcare based childcare centers, we're really reaching out to grocery stores and healthcare providers and partnering with them to make sure that they have good quality childcare, and that businesses like Lowe's are dropping off cleansers and wipes. And so, yeah, that's probably the additional thing that I would add, that really looking at childcare in the community. And then looking at transitional childcare as we slowly open up. We know that some of these other childcare centers aren't going to have capacity or may have to go away, unfortunately. And so we're trying to figure out where we can fit and how fast we can ramp up and work with these other childcare centers that can't open right away because they don't have the means to keep everything safe.
Yeah, definitely. All right, so our next question is about cleaning and sanitizing practices, which is obviously a very hot topic at the moment. So basically, how will these practices look different once we're on the other side of the pandemic? How will all of those practices change? We'll start with Carrie.
Yeah, so I think we all know that perception's going to change, right? And people are just going to want to see, members are going to want to see more cleaning happening. And really, I think what we're going to try to focus on more is what can remain sustainable. Because, you know, yes, it's this kind of peak of everything is going to go down at some point in time. So it's about building something that's sustainable, a cleaning schedule, different products. So we use, I mean, the products we use already kill the virus. So I'm not concerned with that so much. But there are those other products that are kind of surfacing now, like the electrostatic cleaning, where, you know, it's something gets put on, you know, it's good for a while. And we'll, are you guys still there? There we go.
Yeah.
I thought I got kicked off there. It will remain germ-free for a period of time. You know, they promise that, which in our facilities is huge because, you know, we can't constantly, every time somebody gets up, make sure that we're cleaning everything when you have the volume of 2,000 people coming in your building a day or whatever. So we're just looking through all of that, and then what the touch points are. You know, when you walk into your facility, where's everybody going? And then, you know, the phases of your, when you open, okay, you're only going to be open, have this, and this when you open initially. What does that mean? What do they be, will they be touching? We have certain like the hand sanitizer station just at the front of the Y. People are probably going to expect one of those in every area of the building. Well, right now you can't really get your hands on those. So the supply and demand for that. So I think it's going to be difficult too. Yeah, we might have this great plan, but actually getting the supplies to be able to fulfill it is another issue in itself. I mean, our supplier already ran out of all their fogging machines because all these people are, you know, organizations are fogging at night, which is another one. So there's some pretty cool technology out there, like micro voltage cleaning supplies. So yeah, I don't know where all this stuff was before. Maybe I just didn't know about it, but there are businesses that are going to make a lot of money off of this situation, so which is good.
Sure. Yeah. I mean, you never really knew you needed that stuff so desperately before now, I guess.
Exactly. Yeah. And I think, you know, we've always honestly prided ourselves on how clean our Y is, because I mean, I tell especially our healthy living staff, I feel confident that if I walked in with a white glove and went across one of our machines, I'd have minimal to nothing on my finger. That's how great they are at keeping things clean. But it's not going to compare to what people are going to expect when we reopen again.
Absolutely.
And I think I'll just add to what Carrie's saying. The areas that are staffed, it's one thing to clean the equipment, to clean the treadmills, all of the public spaces. I think it's the areas that are not staffed that are going to be equally challenging. A public restroom in your lobby where somebody could come in and you don't know, even with a sign, you might feel uncertain. So it's going to have to look clean. And I think we're going to need to have some level of staff passing through those common areas, door handles into office ways, door handles into restrooms, and so on and so forth. I think all of that is going to change. And then what is the cost, the human cost, the chemical cost, so on and so forth. And at what point will we have the ability to adjust fees? Because I don't think it's out of the chute. I think we're gonna have to live with it for a little while.
Mm-hmm. Absolutely.
Yeah,
Art,
I'd add two things to that. In addition to what they already talked about, is one is accountability. I mean, we really relied on everybody to keep things clean, but we had a housekeeping staff, and that housekeeping staff's not going to be enough. Especially right before, it was hard enough to get a housekeeper anyways because the unemployment was low. It's going to be even harder to keep that staff going. So we're going to have to hold every person from the top down to accountability to cleaning. That's going to be just a known part of their job. Not just when you walk by some garbage, you pick it up, but you're going to actually disinfect on these schedules and then this timing. And then I think the other piece that we're going to have to really upgrade is technology. We're going to have to think about things like no touch. We have 50, 60-year-old buildings in a lot of these rec centers. The plumbing hasn't been updated yet. So, we haven't gone to the automatic washers and the automatic soaps and the automatic towels, because sometimes those are really maintenance headaches. But they're going to be a lot more efficient for us than cleaning between every single person that uses it. We got really excited about the new Digilocks and all that stuff that comes to our locker rooms. Well, now we're starting to rethink those. Should we not have Digilock? Because every time somebody touches that locker, we got to disinfect it. Whereas if they brought their own lock, you only have the LASP that's an issue. So, at what point does customer ease offset the cost of taking care of that cleanliness issue? So I think those things, air quality, HVAC, how much fresh air is coming into your building versus how much treated air is coming into your building, those are going to have to ramp up pretty steadily. So we have to have partnerships with our HVAC support companies and start working on these as fast as we can. And in most cases, it's going to take some capital investment that most of us don't have the ability to do. So we're going to have to get on that, look for grants, look for opportunities where organizations and foundations can support us in doing that.
Absolutely.
Yeah, and I just one more thing to add. I also feel like there has to be that fine line of, okay, there's personal responsibility on things too. So, you could only say, what are you going to do for me for so long that, you got to take personal responsibility for yourself too. That I'm going to clean something off before I use it and after if I don't feel comfortable with it. So we will get to the point where we can only do so much.
Interesting. We made a decision that we are not going to use we have yoga mats that we've used for all the people, and we actually put them all away when we close. We said we're going to tell people they have to bring their own, because there's no way we think that we can give the perception or the reality that they're as clean as people might want them to be. So people will need to bring their own yoga mat for those programs.
Yeah.
That's a good point.
Definitely. Well, we actually got another question related to cleanliness, sort of, or I guess sickness. Anyway, the question is, do any of the panel members have observations on temperature screenings for staff and or members? So do you plan to check temperatures of staff members and or regular members? Just anyone?
Yes.
We only do if it's required.
We'll be checking staff members, but not members.
And we're going to be. Go ahead, Chris.
I was going to say, when March 16th or whenever the first cases started coming out of COVID, we had some members get really upset and wanted us to screen everybody that came through, and he even offered to buy us handheld, kits. And at the time, we thought, oh my gosh, I can't ever imagine a world where we would have to do this as part of our normal everyday life. And wow, has it changed? Because I think there's some level of expectation that we're going to screen, and we're just not set up to be able to do that with the types of employees and the training that we have. We already put a lot on our front desk staff. Now it's going to be even more challenging. So I think we're waiting for the CDC guidelines to come back before we make a definitive decision on that. and we're hoping that comes here in the next 2 weeks, 3 weeks.
Yeah, I think there's a lot of other challenges in there when you start talking about health information, things like that, that we all have to be very, very careful with.
I do know there's Ys out there that have looked at investing in infrared cameras so that their people don't have to be anywhere close. So that there's some technology out there that might assist us in doing this.
And,
Yeah.
and we did redo in part of our camp manual for camp counselors, assuming that we open. We are saying we want you healthy at camp, and to come to camp healthy, you have to arrive healthy. And there's language in there about, we really don't want you going out and socializing at night. You know, as much as young people enjoy doing that, that camp staff going out and being in a large group with lots and lots of other people and then coming to camp, it just adds to the risk. And while we can't necessarily police that, I think we can encourage, and we do have intention to take the temperature of the staff coming back as we move into this new reality.
Sure. So I just got another question, and I like this one a lot. Do you guys have any tips for self-care during this, social isolation age, staying at home, working from home? How do you stay positive? How do you keep active and sort of manage your stress? I could start with anybody.
I think having a schedule is huge. That's the one big thing for me. I recognized right away that as soon as the carpet proverbial got pulled out from under me, personally, I had to really be self-disciplined and get back into a routine. And that wasn't anything of my own creation. It was just something I read, and it dawned on me. Yeah, I got to take off my sweatpants and put my work pants back on, even if I'm at home, and keep with my regular exercise routine and all those sorts of things. And I know it's out there, but stay connected to people. I think it's really easy, especially if you're introverted at all, to really pull yourself back, even if you're in an executive position. So those are the biggest tips, and limit the amount of virtual happy hours. That might be good too. Or add more, I don't know.
Yeah, definitely. Yeah. Any other self-care tips?
I think it is, much like Art said. I mean, to the extent that you can get outside and walk, or stay a little bit active and staying in your routine is important. And be intentional about reaching out to people that you maybe in the normal busy time you don't reach out to friends with the same regularity. And I find myself making more time, if as crazy as it sounds, just to text someone, how you doing? And after a few texts, that might be over, or maybe, hey, can we make a time to talk? And that isn't necessarily always the routine. So it's that not feeling isolated and reaching out to talk about things outside of this deep, intense work that I think we're all doing right now. In some ways, being closed and shut down is more work, and certainly more intense work than the already lots of work that we do. So giving yourself that time to socialize outside of work, as you can.
Yeah, for sure.
Yeah, I think those are great points. The schedule was really critical for me. I learned early on. The other thing I learned the hard way, unfortunately, is working from home. I just kept doing what I do, and my family didn't understand when they can interrupt me and what I was doing throughout the day. So they didn't quite understand there's times when I need to walk away and feel the white space. So after probably 2 weeks of absolute heck for me trying to figure this out, I think just sitting down and talking with the family and say, here's my expectation, here's how I'm going to be at work. When I'm done with work, here's what I'm going to do, so that I'm done with work, and we can hang as a family.
Yeah.
I think that helped me. And then one other thing that helped me a lot was picking one thing every day that I do just for me. And that could be as simple as, sit down with nobody around and watch an episode of Schitt's Creek, or something, some quick 20-minute show. Or I've made a commitment to do, I walk almost 3 miles a day now. I've got 15 days in a row where I'm by myself in most cases, or with my dog, just kind of reflecting on the day and just being alone and doing something just for me. Those were two things that were really vital to me. And it honestly took me a while. I was miserable for the first 2 weeks. I struggled the second 2 weeks, and I'm starting to get back to thriving in these last 2 weeks, and hopefully that'll continue to go up.
Chris, did you find that you had less authority at home than you do in the workplace?
I do, but my assistant here is way nicer to me than she should be. I've had some lunches delivered that I don't get at work delivered.
Yeah. Carrie, how are you caring for yourself during this time?
Yeah, so we've never had any more virtual options than we do now. So there's no excuse as to why somebody shouldn't be working out right now or getting something in. Yeah, with all the virtual options out there, trying something. I love it because I've tried class. I'm not a group exercise person, but I've tried some of our classes that I would never have tried in front of people at home. Our CEO laughs because, that dance like nobody's watching. I say, like, do yoga like nobody's watching, or I did a jump rope class the other day like nobody's watching. I got some welts on my back of my arm, but I'm all right, So you can try something you've never tried before, which I've enjoyed doing. Much like everybody that's probably on this call, I find purpose in the work that I do. So being at the Y gives me purpose. So that's probably what I struggle with the most, is not feeling like I have enough purpose throughout the day. So I cook a lot and I bake. So my neighbors are getting very well fed, as well as my family, of course. But my neighbors are loving this. They keep sending texts like, thanks for dropping that off, or this. I'm like, don't get used to it. As soon as I actually am back to the Y, I won't be doing all of that. But I hope I can do a little bit. But you just want to do something that you never usually do. Like Todd was saying, reach out to somebody, do something for a neighbor, get back in your faith. I know a lot of people that have turned to the Bible right now. What better time to do it and choosing faith over fear, especially us being leaders. We can't be in the fear mode. We can be vulnerable with staff and tell them that we're having bad days or feel for different things, but in actuality, we got to keep moving forward. So.
Absolutely. Carrie, do you deliver down to Louisville? Any of your
it's warm
goods?
there. If it's warm there, I'll be there. So
It's nice and warm here, Carrie. So feel free.
Yeah, I got new friends now. So yeah.
Yeah, you like really rainy weather, right? Because that's what's happening right now.
Pennsylvania has more rainy days than Seattle, so nobody beats us here, I don't think.
What? Okay, I'll talk to you about that later.
Yeah,
so,
we'll have to have a little competition.
Yeah, I know. Well, we have time for one more question, and it's just a quick kind of wrap up deal before we sign off. Can each of you maybe offer your best tip for navigating the next few weeks? Because obviously everything's going to be kind of up in the air. We've all said multiple times throughout this presentation that we don't know when things are going to open back up for sure. Everything is very unclear. What is your best tip for getting through the next few weeks? And we'll start with Chris.
Oh boy, gotta start with me. That's probably the hardest thing I think we could teach each other today is what you're gonna do in the next couple of weeks to make this work. I think flexibility and be honest is gonna be really, really critical. I think I said it before, but be willing to change your mind. If you can I'm very decisive in decision making, and I usually am resolute in that. So to be able to change your mind as you get more information is going to be really important, that you're okay with changing your mind. And I think just we're so lucky in this industry to have really great quality peers who are super passionate about their work. So to lean on your peers, lean on your neighbors, and kind of go through this together. I lean quite a bit on my Nebraska YMCA and Iowa YMCA, North Dakota and South Dakota alliances. Those CEOs give me a lot of opportunity to learn, educate, and feel supported in the decision making that we have. So I would say, if I only got one, I'd say lean on your peers.
Art?
I think for me, the best advice I can for the next 2 weeks anyway, is try to create a date for yourself. I know that we're all living in this nebulous time where we really don't know when we're going to open, but pick a date to try to be as prepared as you possibly can so you can work towards something. I think, you know, I found myself and my staff here, we didn't have that endpoint, if you will, and just by creating something for we could work towards to be as prepared as possible was very big, and it helped us move forward. And if we don't open at the time we think, then that's fine. At least you're prepared.
Absolutely. Carrie?
Yeah, I mean, I agree with both Chris and Art, and I would just add, like, don't get caught up in the what ifs, you know, because this is the time where it could be very difficult and very easy to get caught up into what if this happens, what if that happens. It's good to ask ourselves that. To get caught up in that will slow us down. So we do need to make sure that we're moving forward with that. And yeah, just, you know, our leadership team right now is so solid in understanding and like just being open and putting everything out on the table, you know, and just taking it from there and picking up little pieces of it and making it into something, and making our decisions. And then we're all standing behind that decision. And that's what's key. And we're communicating it the same way to our respective teams, and it's going from there. Being transparent with staff is huge, you know. We don't want them to think that we know some piece of information that they don't know at this point, when really nobody knows anything, right? And we're just taking it. We take it in. I think it's our job to take it in, filter it, and then put it out, and making sure that you're looking at reliable sources for your information, because there is so much stuff floating around out there, and just deciding where you're going to get those sources of information from. If it's your state governor's website, in the federal government where the president has everything listed, or whatever you choose as a leadership team.
Perfect.
So I would have certainly said much of what everyone said. I certainly was going to start with planning and thinking together. There's this is one of those situations where I wouldn't say everyone's in the same boat, but we're all in the same storm. And because of that, we're all trying to point ourselves in the right direction as we navigate our way through this storm. And plan, and then be prepared to plan again, because this is one of those situations where you can't make a right decision and you also can't make a wrong decision, because you're going to be faced with decisions each and every day. And I guess I'll close just by saying, and give yourself a break. You know what? We're all doing the best that we can, and there's not a manual that says, there might be a manual that says if there's a hurricane or a tornado, this is what we do. There's not a manual that says this is what you do when there's a national pandemic and community centers have to find their way through it.
Perfect. Well, that's some great stuff, guys. We have actually run out of time. We managed to talk for a whole hour. That was fantastic. So we're going to sign off here in a minute. This webinar will be available to listen to. There will be show notes about it on communityrecmag.com. So it's been a lot of fun hosting this first webinar. I want to thank Weld Health for sponsoring this roundtable. And of course, I want to thank Chris, Art, Carrie, and Todd for joining me today. I hope you guys had as much fun as I did during this discussion, and I hope all the listeners out there were able to glean some insights and some tips for navigating this pandemic. Thanks again for being here today, guys, and I hope you all have a great rest of your pandemic.
Thank you.